Welcome to the Health During Pregnancy series. It is generally agreed that moderate physical activity in pregnancy is health promoting and increases fitness. Whilst being fit does not guarantee an easy labour and birth, your body and mind will certainly cope better if you're feeling fit and well. Benefits of exercise during pregnancy include better body awareness, which allows for improved postural control of your changing shape. Increased endorphins, which improves physical tolerance for the minor discomforts of pregnancy. Endorphins also reduce stress and anxiety. Decreased fatigue. Women who exercise during pregnancy often report higher energy levels and improved sleep. Maximises postnatal recovery. Women who maintain abdominal and pelvic floor strength seem to be able to activate these muscles again better than those who have been inactive during pregnancy. Assist in maintaining a healthy weight range, maintains cardiovascular fitness and improves circulation, increased endurance and stamina. Exercise during pregnancy should ideally be low impact to protect joints and ligaments. Pregnant women should exercise at a low to moderate intensity to protect baby from overheating. You should feel warm in the face, but not hot. Exercise programs should include both strength and flexibility components. Pilates and yoga both encourage good postural awareness with a focus on abdominal and pelvic floor muscle control. Pregnant women should modify their abdominal exercises to protect their spine and abdominal wall. Sit-ups or abdominal curls are not recommended once your abdominal muscles start to separate. Pregnant women should drink fluids regularly as dehydration occurs more quickly during pregnancy. Try to exercise in a well-ventilated environment in loose-fitting clothing to avoid overheating. Aim to keep exercise bouts under an hour in duration. Allow extra time for your body to warm up and cool down. At least 10 minutes for each phase is a good guide. During recreational exercise, you should be able to hold a conversation. If you become breathless to the extent that you can't get more than a few words out at a time, then you're probably exercising too intensely. This scale, called the Borg scale, rates how hard you are working. We find that people working at a moderate intensity tend to rate themselves between a 3 and a 4 on the Borg scale. This is the scale we recommend you use during pregnancy to ensure you are not overexerting yourself. If you experience any untoward symptoms, such as palpitations, a racing pulse, shortness of breath, dizziness, feeling faint, pain, vaginal fluid loss, or excessive fatigue, please consult with your obstetrician regarding the suitability of your exercise program. It is important to listen to your body. If you experience any of these signs or feel uncomfortable, don't push on, but be respectful of the cues your body gives you. The abdominal muscles provide trunk stability, organ support, and share the workload of the back muscles to protect and move your trunk. During pregnancy, the abdominal muscles separate to allow more room for the baby to grow. This is common, and the width of separation varies from person to person. The fibrous connective tissue in the midline becomes quite soft and stretchy under the influence of the pregnancy hormones, thus allowing the muscle bands to pull apart from each other. Remember, this is not the muscles tearing like a muscle strain, but really your body's way of making room for your growing baby. This is known as erectus diastasis. Erectus diastasis occurs when your long muscles of the abdomen, also known as your six-pack muscles, pull apart from each other. This is seen as a midline bulge when doing a sit-up type movement. To protect your abdominals from further separation, avoid curl-up and twisting actions. Some women will benefit from the use of abdominal supports like Tubigrip or abdominal bands. Please seek advice from your obstetrician or women's health physiotherapist if you feel that these may be of benefit to you. During pregnancy, there can be an exaggeration of the spinal curves, particularly in the lower and mid-back regions. This can result in certain muscles, such as your middle back and calves, becoming overactive. These muscles work harder to compensate for the forward pull on the body as your centre of gravity moves forward. Back pain is a common experience for most people, whether pregnant or not. Pregnancy creates some specific changes that increase your likelihood for back pain as you go about your usual activities. These changes which are occurring are stretchier ligaments. Ligaments are bands of dense connective tissue joining bone to bone. Their role is to limit excessive joint movement. During pregnancy, your body produces relaxin, a hormone that makes ligaments more stretchy in order to allow the pelvis to be flexible for childbirth. Relaxin is in the bloodstream and affects all the ligaments in your body, meaning all of your joints will potentially experience more stress and strain during normal movements. Relaxin remains in the system for up to 2 months after delivery, so it is important that you continue to move carefully after your baby is born. As the belly gets bigger, the body centre of gravity moves forward, which places additional strain on the low back and pelvis. The abdominal muscles lengthen in response to the increasing size of the belly and therefore become less effective. Other muscles lengthen or shorten in response to the postural changes during pregnancy. Lengthened abdominal muscles are functionally weaker and therefore cannot generate enough power to control posture, which may contribute to back or pelvic girdle pain. The joints in the pelvis are a common area that may cause pain for pregnant women. The pelvis is a stable ring of bones which takes the load off the upper body and disperses it evenly through the legs. There are 3 joints in the pelvis: the pubic joint at the front and the sacroiliac joints at the back. Normally, these joints are very stable and have a minimal amount of movement available. Joint stability is provided by the ligaments and the rough bony surfaces with interlocking ridges and grooves. If the ligaments of the pelvis become more lax, more movement can occur and the stability of these joints may become compromised. Normal movements can result in greater shearing forces across the joint and ligaments, and joints may become painful and inflamed. Pelvic girdle pain is pain arising from the sacroiliac or pubic joints. If you have sacroiliac joint pain, you may find that you cannot stand on one leg without feeling a pinching pain in the buttock. You may also experience a clicking or clunking sensation in the sacroiliac joint when you first get up after sitting or resting. The pubic joint can also be symptomatic. You may find that when you step into your pants or shoes, this is painful at the front. You may also get an ache in the groin. If you are getting these symptoms, you need to think about reducing uneven weight-bearing activities like steps and stairs. As much as possible, try to keep equal weight through both legs when doing your usual activities. Modifying how you do your normal activities can help keep you more comfortable. Some examples include sitting down to put pants and shoes on, keeping weight equal between both legs when moving from sitting to standing or vice versa. When getting in or out of the car, try getting both legs out together first and then moving into a standing position. Avoid stepping out one leg at a time. To get in and out of bed, roll onto your side, keeping your hips, knees and shoulders in line. Keeping your knees and ankles together, drop both legs off the edge of the bed and use both arms to push up into sitting. Don't underestimate the benefits of resting, taking more frequent breaks and pacing your activities. Your core muscles are your pelvic floor muscles, deep tummy muscles, deep back muscles, and your diaphragm. Together, they provide stability to the trunk and pelvis and protect our internal organs. Using our core muscles more effectively can help improve stability in the lower back and pelvic joints. Activating your core muscles involves drawing in the lower portion of your tummy and drawing up your pelvic floor muscles. If you aren't familiar with how to engage these muscles, consider consulting a women's health physiotherapist to help you. Some women experience difficulty finding a comfortable sleeping position during pregnancy. From your second trimester onwards, it is recommended that you sleep on your side. Consider using pillows to support your tummy, legs and back during rest, and be guided by what feels comfortable for your body. There are many pregnancy pillows available, but ordinary pillows and U-shaped pillows can also be used. As your tummy gets bigger, it will drag on your lower back, so use a wedge shape or folded pillow under your tummy for additional support. If you have sore sacroiliac joints or buttock muscles, use a thicker pillow to support the top knee so that it remains level with your hip. If you have pain in the pubic joint, use a smaller pillow to avoid separating the joint as much. As your pregnancy progresses, turning in bed will get harder. Try keeping your knees together when you roll from side to side. The pelvic floor is a group of muscles that stretch over the base of the pelvis. The pelvic floor attaches to the pubic bone and the tailbone. It holds up the bladder, uterus and bowels, keeping these organs protected within the bony pelvis. The bladder outlet, the vagina and the back passage all pass through the pelvic floor muscles. These muscles close around the openings of the bladder, bowels and vagina, and these are the muscles we use for bladder and bowel control. As mentioned before, the pelvic floor muscles are a part of the core muscle group and have an important role in supporting your back. During pregnancy, the extra weight of the baby stretches the pelvic floor muscles and makes it harder for the muscles to keep holding up the organs as effectively. When further downward pressure on the bladder occurs, such as during coughing or sneezing, it is harder for the pelvic floor muscles to maintain bladder control. Keeping your pelvic floor muscles strong will help to support the weight of the baby during pregnancy and reduce the likelihood of bladder and bowel problems after birth. Now that you know where the pelvic floor muscles are located, let's try doing pelvic floor exercises. You can do them in any position, sitting, lying or standing. First, relax the muscles in your tummy, bottom and thighs. Imagine stopping the flow of urine and holding it in. Next, tighten the muscles around the vagina and draw upwards. Then, tighten the muscles around the back passage as if you were trying to stop wind. Do this gently so you feel it just in the pelvic floor muscles lifting and squeezing. Try holding this for a few seconds and ensure you are breathing easily while squeezing the muscles. Take note of how many seconds you can hold this for before your muscles start to shake, which is a sign of pelvic floor fatigue. Relax the muscles fully and give them at least 5 seconds to rest before you try tightening them again. Repeat the exercise a few times, but only as long as you can feel the muscles contracting well whilst breathing easy. Once you are confident with isolating the correct muscles, you can try tightening the muscles a little stronger. Try doing these exercises 2 to 3 times a day. Aim to hold for 5 to 10 seconds each time you tighten your pelvic floor and do up to 8 to 10 repetitions at a time. As your baby gets heavier, you may find that you cannot hold the muscles for as long or do as many repetitions. It is also important to use your pelvic floor muscles when it counts. When there is more downward pressure on the pelvic organs, such as during coughing, sneezing, squatting and lifting, make sure you tighten and draw up your pelvic floor muscles to brace against the pressure that is created during these movements. If you're not sure if you're doing the pelvic floor exercises correctly, seek help from a women's health physiotherapist. We hope you found this information helpful and we look forward to looking after you during your stay.